My name is Chip Baggett, and I'm Director of Legislative Relations for the North Carolina Medical Society. I want to welcome you today to our first Advocacy Update video blog. We're trying to do something different. We're trying to start a conversation with you. And this will not replace what we do in our bulletin on a weekly basis to give you comprehensive, detailed information about what's going on in the legislative and other arenas. But we hope that this will be something that will spark conversations and spark some interaction between our members about the leading issues that we think are facing you and facing the practice of medicine. And so we'll start this week and we'll see how it goes, and hopefully it turns into something that is very productive for you and is something that helps us understand the needs and desires of our members better. So I think that the topic at hand is really Medicaid. I mean, we can't get away from talking about Medicaid right now. And what I want to do today is not talk to you about all the different moving pieces in Medicaid, but really boil it down to the essential question that's out there. And I think that this has been missed because we've been so deep in the forest for the last couple of years. And I can't take credit for this. This is something that has been a part of discussions with a lot of people going on recently, but it's something very poignant for you to think about and consider back home. So let's think about it this way. In the past decade, or really 20 years with Medicaid, we've built all kinds of different programs to manage Medicaid. We've built programs like CCNC, where doctors partnered with different groups, other providers, to come together and take care of patients better and thereby save money. We've come up with all different kinds of public health programs to control Medicaid costs. We've come up with all different kinds of hospital-related programs to ensure access. We've developed LME MCOs in order to create a group of people that would be responsible for our behavioral health concerns in the state. All of those things were building programs to manage. The goal really was to manage Medicaid. Over the last few years, with the new legislative leadership that's come in, we've seen a change in that direction. We've seen folks less desiring of managing and more focused on the financing of Medicaid. And when you talk about financing Medicaid, I'm not just talking about the decision about how much money, because we were doing that during the management part of things, but I'm talking about just the simple decision of contributing the money to the program and letting somebody else decide what happens, who gets care, what kind of care they get, how it's managed. Here's your budget, go get it done. And that's the real decision that has come down today. So we're not defending how we took care of our patients before. They're not even upset, I don't believe, with how you've taken care of your patients in the past. It's strictly about how we're going to pay for it going in the future. And when you get to that point, it's not about rates and all those things any longer. It's about who's going to pay, who's going to take the risk. And I think the clear answer for all of us right now is that the state is not going to take that risk any longer. We've passed that point of no return. And so really there are only two options for us anymore. Providers can take on that risk themselves, and managed care companies can take on that risk. And it's clear, folks, managed care companies are here, they're in the state, they're advocating for it, they're begging for it. They want to take that risk. We've been advocating a way to ease into that risk. If you go back to our RFP in 2013, our Medicaid plan that we gave to the governor and to the Department of Health and Human Services, we started with shared savings. We eased into it much in the way that you're doing right now through the accountable care organizations and Medicare. But that was rejected. They didn't want to do that. Here 2 years later, we're under even more pressure to go to capitation immediately, as quick as we possibly can. And that choice really is now. Are we going to do that ourselves, partnered with our hospital, LME, long-term care, and all of our other provider friends out there, or are we going to go to managed care? We've advocated for the position that providers should take that on themselves in physician-led entities, whatever you want to call them. That doesn't really matter. The principle is who's going to take that risk. And so we've set out on this adventure to try to figure out how to do that, how to create that opportunity for you to be in charge of the care that you deliver to your Medicaid patients. We think that's the right way to go. Either way, we're going to have to find somebody to help finance this. Are we going to do it together as provider groups, or are we going to do it with managed care? And that is the discussion question that I think is most pertinent right now, because that's the one that we've got to answer before we can answer any of the other questions that are out there. If you go to our website right now, you'll see from the bulletin this week that we just put up an analysis of where we've been thinking about Medicaid in the legislative sense. So you'll see things like governance and financing and solvency and eligibility and attribution and all these different technical elements of that. But until we solve that first question, until we really clearly answer that question and say we're committed one way or another, we're going to take the risk or we're going to have somebody else take the risk, all those other questions don't matter because the answers to those questions change based on the first question. So we invite you to have this dialogue with us. Respond to us. Tell us what you think. Are you ready to go down this road of taking risk? Are you willing to go down the road and taking this risk? We think you have been. We've heard from you over time, but we're getting to that critical juncture of it's going to happen. So are you ready to do this? Or do we need to consider something else? I think we've been on the right track. I think the track that we've chosen, along with your help, is best for your patients. It's best for you. It puts you back in charge, the very thing that you have so missed for many years. So we think we're going in the right direction, but we need your affirmation. And if you believe in this, we need your help. And there'll be more about that in the coming weeks. Like I said, this is just kind of a beginning point. But we hope that you'll be a part of this conversation. So we look forward to talking to you again in the future. Have a great week.